what are the key messages from the European Society Fibrillation Guidelines?
The main key messages are related to the stroke prevention in atrial fibrillation, to the use of non-vitamin K oral antagonists, to the use of the antithrombotic treatment in patients with atrial fibrillation and concomitant coronary artery disease, to the reinitiation of the oral anticoagulation after a stroke or a transient ischemic attack, to the management of bleeding in patients in atrial fibrillation on an oral anticoagulant, and finally, key messages on rhythm and heart rate control in patients in atrial fibrillation. Of course, for all these key messages, we can discuss a lot of issues and topics. But probably the main key message of the guidelines is related to the new algorithm in terms of stroke prevention in patients with atrial fibrillation, in which the non-vitamin K oral anticoagulants are preferred for the stroke prevention against the vitamin K antagonists.
Okay. And what are the practice implications?
There are major practice implications, and again, the major role of the NOACs is highlighted by the new guidelines. NOACs should be used as a first option in most of the patients with atrial fibrillation because they have a better efficacy or a similar efficacy with vitamin K antagonists, and sometimes a better safety. And what is more important for the safety of the NOACs is the decrease of the intracranial bleeding by about 50% by comparison with the vitamin K antagonist. Another important key message with clinical implications is the new algorithm for the use of combination therapy between anticoagulants and antiplatelet drugs in patients with atrial fibrillation and concomitant coronary heart disease with either acute coronary syndromes or elective PCI. And probably the third most important message of this clinical message of these guidelines is related with the initiation of the oral anticoagulants after stroke of transient ischemic attack, where again the NOACs are preferred to the vitamin K antagonist when we reinitiate the anticoagulant treatment.